Some prominent infectious disease experts are pushing for faster action from global health authorities to contain a growing monkeypox outbreak that has spread to at least 20 countries. They are arguing that the government and the World Health Organization should not repeat the early missteps of the COVID-19 pandemic that delayed the detection of cases, helping the virus spread. While monkeypox is not as transmissible or dangerous as COVID, these scientists say there needs to be a clearer guidance on how a person infected with monkeypox should isolate, more explicit advice on how to protect people who are at risk, and improved testing and contact tracing. Isabel Eckrel, a professor at Geneva Center for Emerging Viral Diseases in Switzerland, said, "If this becomes endemic in more countries, we will have another nasty disease and many difficult decisions to make." An official said the WHO is considering whether the outbreak should be assessed as a potential public health emergency of international concern.